Suvida Healthcare is primary care clinics that provide primary care to patients that are 65 years and older who are on Medicare. At our clinics, we provide services like physical therapy, nutritionists. Patients have an opportunity to meet with a nutritionist. We have a licensed clinical social worker, so they can get all these extra services at our facilities, so they don't have to travel or go elsewhere. Growing up, being first generation in the United States, I was always used as a translator because I was the oldest kid in the family. So I know and I understand the need and how sometimes it's not easy to find somebody to go to the doctor with you and use them as translators. So for me, one of the reasons I'm in Tucson is because there's a high Spanish-speaking population. So I can see the patient without having to use a translator. And I can tell you that patients, when they know you speak their language, there's so much they open up and they tell you that they would otherwise hold in and never talk to anybody or their doctors about. So for me, that's really good to see. The Hispanic population, even though they have health insurance, they don't truly utilize it because they don't know all the benefits. So they started this organization, these clinics, to address those needs and lack of information. All of our staff is bilingual. We came from the neighborhoods that our patients are coming from. We understand the culture. We know how to address the needs that they have and their concerns. We know where those concerns are coming from. So we hope to help them better understand, take full advantage of their health benefits, and really get the care they need versus just letting it go and ignoring the services that they have. We're trying to work with the patient's culture and beliefs. I know that our licensed clinical social worker asks them, how do you want me to work with you? Do you want to work in our traditional method, way of thinking, or the Western style medicine? So he gives them a choice of how they want to address this. We will be offering cooking classes, how to prepare food in a healthy way, where they can continue to cook all their traditional foods, but in a healthy way. How to combine the different foods and make it so we're not asking them to change their way of living, but to work with what they're used to working with in a healthy way. We will also be providing classes to promote exercise and movement. We also provide transportation for those patients that don't have a way of getting to the clinic. Any Medicare eligible patient 65 years and older can give us a call or stop at one of our clinics, and we'll be more than happy to help them and make an appointment for them.